Good evening and welcome to Money Matters. My name is Charlie Huntington and I'm Public Relations Chairperson for Life Sciences PA. Life Sciences PA is a voice of advancement for Pennsylvania's bioscience, medical device, clinical research organization, and healthcare IT industries. Tonight, we continue our special series on science leaders in our local community. Before we get started, I want to let you know that from time to time, financial issues relating to life sciences, healthcare, or technology matters or companies may be discussed on the show. These discussions are not and should not be viewed as financial advice. Moreover, since this program is pre-recorded and shown at a later date, please keep in mind that the information may no longer be current. You should always check with your financial advisor before entering into any financial transaction. This evening, I'm pleased to have with me as my co-host, Kimon Hatza. Kimon is a business attorney and partner at GrowthCounsel, LLC in Philadelphia, Pennsylvania. His focus is in the life sciences, healthcare, and information technology areas. Welcome, Kimon.
Hi, Charlie. Happy to be here.
Kimon, can you tell us what has transpired in your business that may be different since this whole COVID business has come up?
Well, boy, it is a strange new world a little bit. Working remotely every day is kind of strange. My partners and I are trying to have more frequent meetings, and we're doing them this way through video chat, so at least we get to see each other and interact a little bit. For some of my clients, nothing has changed, or things have not changed very much in terms of the work that we're doing on a day-to-day basis. For others, the entire world has changed and their businesses are dramatically affected. In terms of the life sciences, we're continuing to do a number of things for companies, particularly in the healthcare information technology space. Technology companies with data that are in the life sciences field seem to be extremely active right now. We've had an M&A transaction that closed 3 weeks into the quarantine. We've had a number of different financing transactions and even general contracting and corporate work. So in the life sciences area, we continue to be fairly active in that healthcare IT space.
Good for you, Kimon, and I'm sure you guys are helping a lot of people right now in a serious time of need. If you have a question, here's how you do it.
You can have your questions answered on Money Matters. Please go to our website, money-matterstv.com. On our homepage, click on the banner on the right that says, Send us your questions. While you're on our website, you can find information about our host and guests, as well as show notes and links about this show and past shows. Money Matters is also available as a podcast on iTunes and Stitcher, so you can listen to Money Matters while you're on the go. That website address, again, is money, M-O-N-E-Y, -matters, M-A-T-T-E-R-S, TV.com.
So we have a great guest tonight. It's our pleasure that I want to introduce Joe Camaratta. Joe is president and CEO of Quantitative Radiology Solutions, known as QRS. QRS is an early-stage healthcare IT company that helps physicians make optimal treatment decisions by automated analysis of medical images. He specializes in medical technology innovation and commercialization, taking products from concept to clinical adoption. Joe held executive positions for GE Healthcare and Siemens Healthcare and built businesses in medical imaging, cardiology, and oncology. He founded 2 early-stage medical technology companies that apply artificial intelligence to improve clinical decision-making. Joe holds a Master of Science degree in computer science from Rutgers and a BS in computer science from Drexel. He's an advisor to the Entrepreneurial Investing Program of the Crohn's and Colitis Foundation and the University City Science Center's QED program focused on commercialization of academic innovations. Joe's a former committee member for the American Heart Association Science and Technology Accelerator and was previously a partner with Novatorum, a business incubator and provider of venture capital to companies in health and wellness. Joe, welcome to the show.
Thank you, Charlie.
Tell us how you got into the business.
So, as you mentioned, I started my career at Siemens Healthcare. I have a background in computer science and started working in their MRI division in product development. Took a real interest in learning more about the clinical applications of MRI, and started working, eventually in marketing and then in general management functions for Siemens. After a long career at Siemens, I joined the GE for a number of years, also focused primarily around medical imaging and healthcare IT. It was really kind of during that time that I got very interested in trying to understand more around how to bring new innovations to market. And I was fortunate to have the opportunity to volunteer with the American Heart Association in the Science and Technology Accelerator and begin to look at early stage companies, companies that were bringing new innovations to market, in that case, looking at solving the problem or the morbidity of heart disease. When I left GE Healthcare, I really wanted to take this more from just being a volunteer to something that I spent most of my time on. And I began networking, and I met Michael Poisel down at the Penn Center for Innovation, told him a little bit about my background, and he put me in touch with two professors in the Department of Radiology at Penn that had just formed Quantitative Radiology Solutions. We met. We got along quite well and start talking about potential applications, problems that we could solve. And I decided to join the company.
That's great. That's great. Can you describe for our viewers the main problem in cancer care that QRS is trying to address?
So we're really focused on the reduction of side effects for cancer patients that are undergoing radiation therapy. About 2/3 of all cancer patients receive radiation therapy as part of their treatment. Yet 1 in 3 of those patients will incur a side effect from that therapy that's serious enough to either cause them to go to the emergency room or result in an unwanted inpatient submission. So studies have shown that about 50% of those side effects are caused by suboptimal treatment planning. So what we're looking to do is to use our technology to improve that treatment planning process. And specifically what we're doing is we're helping the radiation oncologist identify and outline those anatomical structures that are sensitive to radiation so that during the planning process, they could avoid being over-radiated.
Okay. Well, tell us about QRS and describe its technology to our viewers, please, Joe.
So QRS is an early stage company. It was founded in 2013. As I mentioned, I joined in January of 2015. And we've been fortunate enough to secure a number of SBIR grants to bring our technology to market. Probably the best way for me to describe the technology is to think about it a little bit like facial recognition in Facebook. So when a patient has a CT exam done, so say it's a CT exam of the thorax, we're able to look at that CT exam and tag it. This is the heart, this is the left lung, the right lung, the spleen. We're able to recognize all the relevant anatomical structures in that image, which is something easy for a human to do, but not so easy for a computer to do. Once we recognize those structures, we can analyze them. In the case of treatment planning, what we're doing is we're outlining those structures and using that information to feed the treatment planning system.
Joe, just following up on one thing that you and Charlie were talking about, and you and I talked about this a little bit the other day when we had our call. As the technology that you're developing helps improve the planning, has the equipment that's actually used to radiate the patient, targeting tumors or whatever it is that they're looking for, has the equipment caught up, or is it where you are, so that even though you've improved the planning, is it precise enough to stay within that planning that you've helped them with, so they're not damaging healthy tissue that's nearby?
Kimon, that's an excellent point. I would say actually that the equipment is leading where we are in our capabilities. If you look at the most recent iterations of radiation therapy, specifically a technology that's called proton therapy, we're able to deliver extremely high doses of radiation to very precise positions or destinations in the body. And that's a great thing if that radiation's hitting a tumor, but that's a bad thing if that radiation's hitting a sensitive structure such as the heart or the esophagus or the lung. So what we're trying to do is we're trying from a planning perspective to catch up to where the hardware is by producing automated tools that make the planning process also more precise.
Now, what happens if during the course of treatment, and if the treatment's effective, a tumor is going to shrink, right, over time, hopefully, with that treatment. So I'm assuming that as the treatment continues, you have to keep updating that plan to make sure that the radiologist that's giving the treatment to the patient knows of the change and has made the proper adjustment so that it's focusing again on the tumor that has now shrunk or whatever, it is not hitting anything that it's not supposed to hit.
Yep. I mean, when a patient undergoes radiation therapy, they'll undergo a course of treatment that could last 6 to 8 weeks. The plan that I mentioned is usually is performed at the start of that treatment. So a patient will get a CT exam, a plan will be created, and treatment will start. So during that 6 to 8 weeks, we can expect a number of changes to occur. So hopefully the tumor is shrinking. But also because, the patient is ill, the patient could also be losing weight. So the anatomy is changing over that time. So there's this concept of what's called adaptive planning. And that means that during the course of those 6 to 8 weeks, the radiation oncologist is looking at the changes in the anatomy and then adjusting the plan to account for those changes. Now, today, this doesn't always occur, or maybe I should say differently, it doesn't occur as frequently as it should because there's only so many dosimetrists. The dosimetrists actually create the plan. And their primary focus is getting the new patients started on treatment because there's strong evidence that the faster you get patients started on treatment, the better their results will be. But they don't always have the bandwidth in order to do the adaptive planning. By our work, by taking the process that we're looking at, which might take as long as 2 hours, and reducing it down to 10 or 15 minutes, that efficiency improvement should allow the dosimetrist to also replan during the course of the treatment, which would help to reduce side effects.
That's great. Is there proprietary IP that you have at QRS?
Yes, so we are a software company. Our technology is a AI-based algorithm that does automated analysis of medical images. And what Dr. Adupa and Dr. Tarigian at Penn in the Department of Radiology, they run a group called the Medical Imaging Processing Group. And they actually came up with a new way of doing this so-called contouring or delineation of anatomical structures. They basically automate, first of all, recognizing the body region. So am I looking at the head and neck or the thorax or the abdomen? Once they are able to automatically recognize the body region, they can go in and tag those anatomical structures that I talked about. So that's the second step. And then the third step is when they've done the recognition, they can do analysis, in our case, the delineation. So that technology, that approach is a novel approach. There's been patents applied for pieces of that. There is, copyright in terms of the code that they produced around that. But also we have analyzed over 1,000 imaging data sets as part of our work. And we've annotated hundreds of those data sets in which to train those languages. So that's also an important piece of our intellectual property.
How does your technology compare favorably to what's currently being utilized on the market by physicians?
So we do some extensive customer discovery work before we actually dove into this area. We were able to, talk to a number of radiation oncologists, talk to dosimetrists, watch what they did today, watch the tools that they had available to them. What we learned was that they did not use the current automatic segmentation tools because they were not accurate. What dosimetrists told us was that often the automatic contours that they produced required so much manual manipulation. It was easier for them to just do it from scratch, do it by hand just to start. The other problem that they had was that in a body region, I talked a lot about the thorax, there's 17 different structures that might need to be contoured in order to do that treatment plan. But most of the algorithms only covered, kind of the major structures, the major 3 or 5 structures, and the dosimetrist still needed to do the rest. So they were two of the things that we really targeted, is improving the accuracy. Therefore, there would be less manual manipulation, and then also making sure that we were comprehensive in our approach in being able to contour all of the relevant structures. And the third thing that we really focused on is being able to work in multiple body regions. I mean, there's head and neck cancer, and there's lung cancer, and breast cancer, and prostate cancer. We want to be able to work in all of those body regions so we can accommodate as many cases as possible.
When do you expect your product to make it to market?
So we are currently in clinical evaluation at 4 academic medical centers, like University of Penn, Rutgers University, New York Proton Center, and Washington University. And that evaluation will be concluding this summer. We have already filed for a pre-submission meeting with the FDA, and that meeting is scheduled for the end of May. We expect to complete our FDA submission at the end of June and be in market by the end of 2020.
At the end of 2020, wow. So what strategies will you be using to become integrated into physicians' treatment plans?
Yeah, I mean, we're fortunate enough in working in the area of medical imaging. There's a standard called DICOM, and this standard allows us to collect CT exams from the CT scanners of multiple manufacturers and create contours that could be used by multiple treatment planning systems. So that whole DICOM allows us to automate a lot of the workflow around that. We have a SaaS-based platform today. So we'll be coming with a cloud-based implementation that will accept images coming from either the CT simulator or the treatment planning system. We will do the automation. We will completely automate the contouring process, and we'll push those results back into the treatment planning system. So, integration into the physician workflow or the dosimetrist workflow is very important in terms of adoption, and we're addressing that in our platform development.
Look, you say it's SaaS-based. Does that mean that people will literally subscribe to your service, or how mechanically is that going to work?
Yes, I mean that's our plan. We could offer various subscription models depending upon the overall volume. I mean, you take a system like University of Pennsylvania or Washington University, and they're doing thousands of patients in radiation treatment. But we also have to recognize that radiation treatment is delivered at community hospitals and independent centers where they have a different economic threshold for a solution. So by us putting together a SaaS-based model, we're able to put various subscription models that meet the needs based on the volume of patients that are seen by a site.
I see. That's great. Charlie?
Joe, how are you presently funded?
So, as I mentioned, we have funded the product development and clinical evaluation efforts through SBIR grants. We had grants from the National Science Foundation and the National Cancer Institute, and we still have a grant from the National Cancer Institute that we're working on. But in addition to that, we've been able to raise some equity funding. From Phase 1 Ventures down at the University Science Center has actually provided us with 2 rounds of equity funding. And that's really allowed us to develop out our our quality management system and develop our FDA strategy. I mean, we're a regulated product, and we need to adhere to the regulations of the FDA around bringing this product to market. And that funding has really helped us to do that. We've also been able to get some funding from Ben Franklin Technology Partners in helping to advance our efforts.
That's great. And what makes QRS unique for an investor?
So I think the thing that really makes us unique is just the large amount of non-dilutive funding that we've been able to bring into the company to fund the product development and clinical evaluation. And that non-dilutive funding is it really helps in terms of keeping our balance sheet clean. So now when we're doing some fundraising around going to market and commercialization, I think an investor will come in to a company with very little dilution and be able to see a way to an exit within 2 years.
That's amazing. How many jobs would you say you've created through QRS?
Yeah, we currently have 5 full-time employees, 3 of which are located in Philadelphia area, and all 3 of the ones, including myself, that are located in the Philadelphia area are graduates of Drexel University. We've been very fortunate to find some really high quality biomedical engineering students coming out of the program at Drexel University. And they've helped us in terms of our data management and annotation efforts, as well as our product management and conducting the clinical evaluation. Our other 2 employees, one is in New Jersey and one is in California.
And just a COVID question for you. How has COVID changed the way that you all are able to work together for the time being?
Well, I mean, we're fortunate that we're a software company. So when everything started to close down, we're located at the Cambridge Innovation Center on Market Street, and the people at CIC were great in keeping us updated as to the handling of the facility, and gave us notice that they were going to be closing the facility to businesses that weren't using the labs directly. So we were able to get our equipment and then just move it back to our homes and apartments. So we went from 1 office to 5 offices overnight. But with using telecommunications technology and Zoom and Slack and things like that, we've been able to keep the ball rolling and continue to collaborate.
It's great. What would success look like for you and for QRS over the next 5 years?
Yeah, I think for QRS, it's really around driving adoption of our technology. I mean, we have a plan that we've built out in terms of going to market. I mean, we'll focus largely around those newer technologies that deliver higher doses of radiation to more precise points. They have the most acute need for more precise planning. So they'll be our early adopters. We'll target those. But really, I would say within 5 years, I would like to see, that automated contouring of organs at risk is the default, and not the exception, but is actually the default, right? I think beyond that, we're going to continue to look at automating, other parts of that process. I think there's a lot of work that could be done in order to, further catch up to where the hardware is in terms of delivering more precise treatments. And also allowing the physicians and the dosimetrists to spend more time on value-added tests, more time with the patients, less time in front of their computers. So that's some of the things that QRS will be working on in the next 5 years.
Kimon?
Yeah, Joe, what advice do you have for folks who have been displaced by life sciences or technology companies in the Philadelphia region who may be trying to decide whether or not they want to develop a company of their own around the technology with which they are familiar?
Yeah, I would say, first of all, if your entry is because you've been displaced, I would go slow. Just to kind of give you my own personal anecdote, when I first met the founders of QRS and we talked about the technology, I said, oh yeah, 2 to 3 years and we'll be a market and we'll be able to sell the company. So that was 6 years ago, right? And we're still just getting to market now. So I would say go slow. It's definitely going to be a a long process, and it has to be one that you're passionate about. You really have to be willing to, dedicate that amount of time to it if you want it to be a success. The second piece of advice I would have is don't fall in love with technology, but fall in love with the problem, right? And you really got to convince yourself that the problem that you're trying to solve is an important one. And also that people are willing to pay to have that problem solved. I've seen a lot of people who have a technology first perspective, and they don't know exactly how the technology is going to be applied, or they don't really have a compelling reason as to why it should be adopted. So first of all, find a problem that you're really convinced needs to be solved. It's important. People are willing to pay for, and then take the technology and focus around that problem. The third thing is make sure that you surround yourself with a great group of people. And I am so fortunate at QRS. I mean, first of all, from our founders at MIPG, I mean, they've been incredibly supportive through the whole process, not just in terms of continuing to develop the technology, but in advising us, right, in how to bring the technology out of Penn and into our company and get it ready for clinical use. And just the people in QRS that I'm fortunate enough to work with on an everyday basis. I mean, it's a great group of people. And, you wake up in the morning and you want to start interacting, you want to have conversations. It's one of the things that we talk about on our Friday afternoon virtual happy hours. It's just, we just miss kind of the face-to-face communication that we used to have on a daily basis. But definitely surround yourself with people that you want to work with over that time, because it is a long haul and you want to be surrounded by a great group of people.
Joe, we have about a minute or two left. I just wanted to ask you one last thing. From your perspective, since you've been in this region for a while, what do you think are the biggest challenges or opportunities for the greater Philadelphia area in terms of sustaining a vibrant medical device and life sciences community?
I mean, the biggest challenge is to constantly be refreshing the companies that are in that community. I mean, we read about mergers and acquisitions in this field every day. So companies that are here are getting acquired or maybe merged, jobs are going elsewhere, right? The only way to deal with that is to have a constant group of new companies that are coming in and being able to hire people and being able to continue to develop the life sciences community. I think the biggest the biggest opportunity we have are our universities. I mean, I talked a lot about technology coming out of Penn. I was involved with some technology out of Temple. I've looked at things out of Drexel. We have such a strong foundation for medical technology in this area in our local universities. And we really, really need to focus on how we do a better job of getting it out of the universities and building companies around it in order to drive employment in the region.
Okay, thank you. Charlie, I think we have less than a minute to go.
Great. Thank you, Kimon. I especially would like to thank you, Joe. You are a great guest. I hope you will come back and bring us up to speed with how QRS is doing in the future. Kimon, thank you for co-hosting what is our first COVID episode from afar. I would like to say good night to the viewers and remind our viewers in closing how they can send a question in. Before I do that, our next guest is going to be Mark Rabarczyk. He's founder of Viewer, which is a crowdfunding platform. So thank you for joining us. Good night.